Well, good evening, and welcome to the Global Public Health Lecture Series, which is co-sponsored by the Global Public Health Program and the Institute for Health and Humanities. I'm Peter Kern. I'm the director of the Global Public Health Program, and happy to see you all here tonight. So we've got a really interesting talk coming up tonight. Angela Haugo is going to be talking about kind and crucial care for Kenya. That's a country that I've been to and heard a lot, read a lot about, so I'm really excited to hear what Angela has to tell us about her work in Kenya. So Angela has enjoyed 2 mission trips to Kenya in the summers of 2015 and 2017, and she says that changed her life in wonderful ways. She practices family medicine with a strong emphasis on wellness and prevention. At 6 years old, she knew her calling in life was to be a doctor. Dr. Haugo graduated from the University of Montana with a bachelor degree in 1998. I think I missed you, right? You didn't have any classes from me at that point in time. Then she went to Des Moines University for medical school and completed her physician residency training through the family medicine program in Spokane from 2004 to 2007. She worked as a family medicine doctor in downtown Spokane for 5 years before moving to Stevensville to be closer to family and enjoy a change of pace with a rural practice. And as you probably know, we really need physicians working in rural, underserved parts of our country and the world. She practiced as a traditional doctor in Stevensville for 5 years and then decided to take a new path. Last August, she started an independent practice in Hamilton, integrating wellness coaching and family medicine services. She's passionate about finding an individualized plan for improving health and well-being for everyone. She focuses on nutrition, fitness, stress management, including mindfulness and meditation, developing constructive thinking processes, and life balance. Dr. Haugo wants to be part of a revolution of positive change. She believes that being healthy is contagious, as one changed life causes a ripple effect to those around that person. So please join me in welcoming Angela Haugo for tonight's lecture.
So thank you so much for coming and listening to this talk that I'm going to be giving about Kenya. I'm hoping that you can appreciate that this is not just a talk coming from me and the information that I want to relay, but also coming from all the interactions of the people that I've met in Kenya, that they're coming forth with me. And Kenyans are really friendly and very smiley, and if they were in this room right now, they would go around and shake every one of your hands and want to know your story and what you do and who your family is. And so hopefully this is kind of in that atmosphere of kind of knowing each other and getting to know the Kenyans today. So the title for my talk is called Kind and Crucial Care for Kenya. That came from my 86-year-old grandma, and it won the contest for the catchiest title. The picture that you see up here is actually the picture of me and my sister. As it was said in the introduction, I knew when I was 6 years old that I wanted to become a doctor. I was watching Sally Struthers commercials where they were talking about poor Ethiopian children and showing pictures of them being malnourished and that the help they needed. And that's what really inspired me to become a doctor. I had said, okay, when I grow up, I'm going to be a doctor and I am going to go help the Kenyans. And it took a little while, of course, for that dream to come to fruition. If anybody is still feeling the pangs of tuition and education costs, it takes a while to get through a lot of school and even longer to pay for some of that school. And along the way, I had children. So it was kind of a long path, but I finally got to make that dream come true in 2015 for the first time. I have a lovely assistant here today. So let's get you familiar with Kenya just to refresh your memory. So Kenya's over here more on the eastern aspect of Africa. And then if we kind of blow up the map this way, we flew into Nairobi. And then we were going to an area that's by Lake Victoria, but just a little bit south on this little arm extension here. And if you blow up that map of that arm extension where Lake Victoria is at, this is Oma Bay, where we would stay at night. And this is Kendu Bay, where we did some of our work. And probably this whole radius in here, Kisi was part of the area that we went to. And this is all a rural area in here outside of Oma Bay. Oma Bay is pretty big. All right, next. Thank you. So Kenya is about 48.5 million people, and 42% of the population live under their poverty line, which is living off approximately $1.90 per day or less, which is pretty incredible. I don't know if anybody here has tried to live off of $1.90 a day, but that's pretty meager for your assistance. And the AIDS and HIV epidemic is very rampant there. It's improved throughout the years, but it's still very prevalent. It's estimated around 7%, and some of the reason that it's gone down is because of the number of deaths. So the number of people living with HIV and AIDS has reduced for that reason, which is quite sad. 1/3 of the new cases are actually in children, which is, of course, really challenging as well. There's more than 10% of Kenyans' 15 million children that are orphans, and a lot of those are due to HIV deaths. So Kenya is always trying to figure out how to support these orphans. A lot of times they will go with family, but you can just imagine if you're a family with 7 kids, 8 kids of your own, you can't take on another 5 children. The mortality rate for children under the age of 5 is 74 in 1,000, which equivalates to 93 child deaths per day, almost 100 deaths per day of small children. And this is in that stark contrast to the US, where we only have 6 children in 1,000 that die under the age of 5. Will you next go to the next screen? Spring of Hope International is the organization that I went to Kenya with. It's actually started by David Opop, and he is actually from the area that I had shown you on the map of the African village. And he had a number of his family members who died of waterborne diseases, and made it his point in life that he was going to change the circumstances not only for his family, but for many of the families in that area. His sister was able to save money and send him to college in the US. She worked for many years, 2 jobs, had no life, so that she could send her brother to the United States in a faith and belief in his mission and in his passion. And then he started the nonprofit organization Spring of Hope International. Recently he moved to, I guess not too recently, but a number of years ago, he moved from the Minnesota area to the Spokane, Washington area, which is where he runs his organization now. There are about 2.2 million people in developing countries, of course most of them children, who are dying every year from diseases associated with the contaminated water, polluted water, inadequate sanitation, and poor hygiene, which we'll talk about as we go along here. And I did include the website here, as well as pamphlet materials over at the sign-in station, in case you would like to look at the website and know more about this organization. Go next. This is a picture of David and I together. This was towards the end of safari, so you can see I have a nice little sunburn from being out in the sun so much. The vans that we drive through the safari have an open top, so there is a lot of sun exposure. And during the day it gets quite warm, but as soon as that sun goes down, it gets pretty cold, so I'm wearing a jacket. Okay, so Spring of Hope International has 4 main emphases. So the first emphasis is the clean water sources. So they have gone into that area where really there are virtually no wells, and they have drilled a number of wells. I think at this point they're somewhere around 20, and they're actually trying to see if There are drill holes that they can use that maybe were previously attempted. The ground there is really difficult. It's volcanic ground, so it's very, very hard. The first well that they did, I believe in 2009, cost $60,000. So you can imagine these people that are living on maybe $1 a day. How would they come together and put together the money and resources for $60,000 to build one well? Since that time, he's been able to find ways to make the wells more affordable by contacting other contractors and finding ways to make the labor a little cheaper. But overall, it's still a big expenditure to try to find these freshwater sources out in these really remote areas. But of course, the people are extremely appreciative, and it's really made a dramatic difference in those environments. The other things that he also established is rainwater catchments and establishing, we'll show you these big containers in which they have a pathway for the rain to fall into the catchment, and then they can use that at any time. Of course, it's more sanitary than what they're getting from the ponds or the rivers. The next thing is educational opportunities. So he actually has a child sponsorship program for which there's pamphlets too. And the child sponsorship program just allows people to pay $35 a month to support the needs of a child so they can go to school. Anybody that's a child in Kenya can go to school. It actually doesn't have to cost money, but the caveat is if you don't have a uniform and you don't have supplies, you don't get credit for that time in school. So when it comes for high school, you actually have to be able to show that you went through all the educational levels to apply to high school, and not everybody can go to high school. It's actually more of a dormitory, remote high school. So when you pay for a child to go to school, you're actually giving them the opportunity to go farther in their education and to get credit for what they're doing. Also, economic empowerment. So he's encouraging cooperation and exchanges of services and supporting sometimes we'll have one group of people in the village areas who are growing plants that will exchange plants for services such as millet flour. So he's supporting these organizations that are doing exchanges of services. And there's another number of pictures I'll show you of the opportunities that he's trying to give the Kenyans to be independent economically. One of the biggest and most popular things that he established is the farming school, which we'll talk about too. And then we have spiritual development. So he spent time, some of the mission trips were a focus of pastoral and spiritual leadership education. We've also bought a number of Bibles and given them to people. In these remote areas, to have a book at all is actually a privilege, let alone to have a full Bible. They're quite expensive for the Kenyans, so they really, really cherish that. Can you go next one? Okay. So the African women walk an average of 3.6 miles per day just to collect water. And it actually is usually the job of the girl to do it, the younger girls in the family. So you can just imagine if you have to walk 3.6 miles to fetch water, bring it home for the family, how enthused you're going to be to get home in time to go to school, get ready and go to school. So by making these water wells available, it actually has improved the attendance of children, especially girls in the family. And not only that, but if you're getting clean water sources from the wells, then that also has improved the school attendance because you're getting less people with infections. So, and this is, of course, the difference between, oh, I should turn down the lights a little. So this is the difference between, of course, Kenyan water and something that might resemble our water. This is a girl balancing the bucket on her head. And this is my friend Amy, who went on the mission trip, standing in front of the dirty, muddy river water. So that's where you'd be drinking out of. Go ahead. And this is a clean water map. It's a little bit hard to really view in perspective, but David's first goal is to get clean water sources within 1 kilometer, which would be about the equivalent of 1/6 of a mile. within everybody in a 50-mile radius map of where this large rural area is. And so all the green areas are achieving that goal because they already have a well there. There's also a map showing catchments. And then these areas here, the yellow means that there's 2 kilometers to get to a well, and these areas shows that there's 3 or more kilometers to get to a well. So you can see there's been a lot of improvement since 2009. All right, so drilling the wells, there's been a number of wells implemented all over the designated areas, and so this is actually, this guy would be equivalent of almost like a mayor. He's the head of a village, a small village in there. And so this is one of the social workers from Kenya washing his hand in the well. And this is one of the people on the mission trip. These are 2 of the teenagers that went on the trip with us to the last Kenya trip, and they're trying out the well. And actually, we all had an opportunity to balance that water on your head, and it is very hard, harder than it looks to balance that water, and a lot harder on your neck muscles than you would think, especially with these buckets mostly full. And this is that water catchment that I was telling you about. So this is established at some of the schools that are in this area and have really revolutionized their access to clean water so that they don't have to have the students going to the wells as often. And actually that's a fuzzy picture, but that's David beside that. Okay, and so tens of millions of children cannot go to school as they have to fetch the water. We are saying on an average 3.6 miles a day. The dropout rates for adolescent girls also dramatically goes up as soon as they start getting their menstrual cycles because they don't have the sanitation. So the first mission trip I went on in 2015, this is a picture of the girls holding sanitary napkins, which means that they can actually stay in school and they don't have any problems or have less problems with attendance. I mean, that's how desperate sometimes their conditions are. I don't think there's any girl that's ever missed school because they didn't have sanitation supplies or something that they could use impromptu. And then this is one of the schools that we visited, and we gave them a number of vitamins that were donated from Thorn and electrolyte fluid. So as we're talking about these people getting their infections, of course dehydration is a big issue, so bringing electrolyte fluid was really important to trying to make sure the schools had electrolyte balance to offer those children to try to prevent dehydration. And then economic empowerment, which we were talking about. These are pictures of, this is a picture of the farming school. So when Kenyans go to the farming school, they can get a scholarship to go to the school. They learn the best ways to plant the plants. They actually had a private donor that contributed money to Spring of Hope International, who had American Department of Agriculture come in and do soil samples to decide what kind of vegetables would be the best to grow in their particular environment. And so anybody that goes to this school actually gets seeds to start their own farming so they can develop that independence, one, for food sources for themselves, and if they have enough land, then they can use that for exchange of services. So this has been probably one of their most phenomenal business resources for helping people be independent. But there's one caveat that we can't prevent in all those calculations, and that is drought. So Kenya has been really suffering with drought, and last time when we were there in 2017, it was extremely sad to see people had spent the time cultivating and planting these plants, and so many of them were dead and withered, and there was nothing left to them. This is an HIV support group that Spring of Hope works with, and they're the ones that make these like little starting plants for bushes and trees in exchange for other services. And so they donate these or exchange these to the school because there is a lot of problems with soil erosion over time with people cutting down the trees. We're noticing that there's open areas where the water will come and flash flood. But if we get more plants in those areas, again, when we went in 2017, these plants looked quite withered compared to this picture from 2015. And then over here, livestock. So, you know, when you sign up for Spring of Hope or you're donating, you can specify how you would like to use that money. And one thing that's really helpful, of course, is buying livestock. We mostly saw chickens and goats. This is actually a cow that's actually a property of the school. And so he actually meanders in and out of the classrooms, which is pretty funny compared to American schools. And then you can see the school children in the background. Of course, they don't care. They see the cow all the time. I'm pretty sure if my son saw a cow, he'd catch his attention. All right, and then other economic opportunities, seamstress. So all these kids we were talking about have to have a uniform if they're going to get credit for school. And so we need seamstresses to make all these uniforms because they're unique for each school. Each school has their own color. And then this would be another example of exchange of services. She has, of course, some kind of maybe millet flour or something on her head that she's using for exchange of services. And then spiritual development. So these are the churches some of the churches that we visited, and in which it's amazing. You can't really see it, but the children sometimes will sit at the front of the church, and church goes all day. And our children have a hard time sitting for 10 minutes. And these children were sitting on a mat in the front of the church for 3 hours. And my mom and I were just flabbergasted. Church goes all day, so I have a little clip to show you. So you can attend church for just a little while. Of course, singing is really big in their culture, and it really brings their celebration to life. And this is the beginning of church. So there are some empty chairs, but as church goes along, more and more people will show, because at the end of church, sometimes they will give people samples of millet flour or food that they can take home for their families. And go on the next one. Oops. All right, so this is the Kenya mission trip. Oops. Kenya mission trip 2015. So this one I went with my mom. My mom's in the back here. And so it was a relatively small group, and it was mostly focused on pastoral care and education. And then the other thing, my mom and I were responsible for wellness teaching, which was really fun. You can see a picture of me with the children, and they're all holding up toothbrushes and toothpaste. Colgate toothpaste is really popular there at the stores, not, of course, in the villages at Oma Bay, the city. And then, of course, we brought some fun balls and things for them to play with. So with the wellness education, our primary focus, it might seem like it's a little obvious, but for the Kenyans, it's really important. Washing your hands, you can imagine, with a limited resource of water. So the average Kenyan family uses about 5 gallons of water a day, as opposed to Americans, it's 100 gallons per day. And so you can imagine, if you have a tiny bit of water, are you going to use it for drinking? Are you going to use it for washing? What are you going to use that water for? They are pretty good about washing their hands before eating. I would say actually better than Americans, but it's still something that in their culture, if they don't have access, say they're out in the fields and they see a bush that has fruit, then they're likely just to take the fruit off the bush and start eating it without washing their hands. So washing the hands and making sure that they counted how long to do it for. Boiling water and cooking food to get out those contaminants. So asking them to count how long that they have the water boiling for. And then using the latrines. So it is actually a privilege to have an outhouse in Kenya. A lot of them just go out into the grass or whatever the nearest tree area is. And some of that contamination gets into their water sources, their food sources. So it's really important, if they have access to a latrine, to use them. Some of the schools that they have, with a population of 300 children, do not have any kind of a latrine. So that was one of their projects, is to actually build a latrine in this area where kids were just having to go out into the open area. And then, of course, brushing their teeth. Most Kenyan children and in the village areas, they do not brush their teeth. Even in the cities, a lot of them do not brush their teeth. I think in the line of priorities, it just has not started to take a higher level. But that was something they really enjoy if you give them a toothbrush and toothpaste. You do have to be a little careful with the toothpaste because the children will eat it. They think it tastes sweet, so they'll think it's like candy, and they'll just want to eat all that fluoride. And then we were trying to teach them about eating vegetables and proteins and moderating their grains. So you can imagine in a situation where you have such few resources that usually the grains are what people are eating the most. And then using condoms for the risk of HIV transmission or other sexually transmitted infections is important as well. So this is a picture of my mom and I brought the sanitary napkins, but we also brought menstrual cups. I don't know if guys are familiar with that, but it's essentially reusable during menstruation. And there was some caution about like how we were implementing this, so we did a focused education group on it. But here my mom and I are taking those out and organizing those so that they'll be available for the women. And you can also imagine if you're on restricted income, why would you want to pay for sanitary napkins if you're just struggling to get food? But this gives them an opportunity to have a long-term solution for that. And this is actually at that education group where we're teaching them how to use it. This is Grace, the social worker. I'm pretty sure she's a human angel, that she donates so much time and love to the people that she serves. And she was a fantastic interpreter. And when I was talking about the latrines, so this school had no latrines until Spring of Hope International came and actually gave them this dual-sided, so there's 3 sides, and they actually have an area for girls to take a tiny shower if they need to clean themselves for that sanitary purpose. And then this is talking a little more about that efforts towards the balanced diet. One of the problems is if Kenyans want to make a social statement about having more affluence, then they don't want to eat their vegetables anymore because meat is prized more than vegetables. The kale is also called sukuma wiki there. Is the most popular vegetable. It grows anywhere in the Kenyan areas that we saw, but sometimes, just like American kids, they don't want to eat their green veggies. But it is their most dense nutrients by far. The diet is really high in grains because that's the easiest to grow. So it could be maize flour, millet flour, sorghum flour. And they use it to make ugali. So it's like this big mound or almost like a big cake of any combination of those flours, and then they cut into that. And then the other that they really love is chapati. And chapati is almost like a tortilla. And the Kenyans really love that. And so when my mom and I were teaching the Kenyans about moderating their grains, we would tell them, eat 2 chapati, not 20 chapati. And they tended to like that. So we would see people and they would say, 2 chapati. This is typical for what we would eat on our mission trip. This is sukuma wiki. There's a tiny bit of eggs in here, and then fish because we were close to Lake Victoria, a lot of tilapia. People that are living in the rural areas, they don't have quite as easy access to the fish like we did in Oma Bay. And this is pretty typical for a spread. This is a welcoming spread, and they've sacrificed a lot to give us this nice display of food that was really quite tasty. One of the most unusual things we had was a pot of tiny quail, and they take off the feathers, but they don't actually remove the meat, so it's actually the intact body just sitting in a soup bowl, and sometimes it's a little hard to look at and eat. But I was told it was tasty. I didn't try it. All right, so child sponsorship. This is my child that I sponsor. His name is Eric, and Eric is extremely shy. You can see right here, he's like this. He's kind of afraid. I keep getting closer and he keeps moving away. But I was trying to think of what would be really special to give Eric when I visited him, and I gave him the Bible that my grandma gave me when I was young, and he was very grateful. He quietly said thank you. And then he asked the social worker for a question, and I said, well, what did he say? And she said, well, he was wondering next time you come if you can bring a soccer ball. And I was like, of course. So they actually let me go to the store the next day and go buy Eric a soccer ball. But this is pretty common living conditions in the houses in the village areas. So this is kind of a kitchen area, which is pretty meager. They actually have hanging pots to keep animals out of it or for drying. And then they have these bunk beds. So the whole family sleeps here. And I'm trying to remember, I think there's a picture coming up, but I think that there might be 6 kids. So there'd be 6 kids and parents all sleeping in this tiny room. Go next one. Oh, here we go. Yep, here's the picture of the soccer ball, bringing it to Eric. And these are some of his siblings. And then this is gearing up for round 2. So that was Kenya 2015. And so David said, we had so much fun and we did so well. Would you like to do a true missions trip in 2017? And I said yes. Now, I've never been on an international missions trip before, so this was really, really interesting to try to plan for something like this. I was able to tour some of the village clinics and get an idea for the common diseases that they treated there, but it still was quite the challenge of trying to see how we would pack these things, what we should actually bring. And so these pictures show us packing up here, boxes and boxes and boxes. We each were able on the mission trip to bring 2 50-pound suitcases full of supplies. And then, of course, we had our small one carry-on for all of our personal supplies. So here we are being silly. Here we are at the airport, last minute trying to move this, move that. Fortunately, I had one of those suitcase hangers at the house that we could measure the suitcases. So it would have been nice if we could put all of one kind of medicine or vitamin in one bag, but because it sometimes weighed too much, you'd have to put some ACE bandages here, and you'd have to put some heavy stuff there. And so this is Jean, of course, being silly and wearing an ACE bandage skirt. And then this is us at arriving at the airport in Nairobi and praying that we would get through customs. When you go through customs in Nairobi, they can confiscate anything that they consider suspicious. And so we're coming through with bags and bags and bags of our whole entire team coming in with these medicines. And so there was a little bit of nervousness about how that would go. David had never brought that many medical supplies. And they had at his church, they had a big prayer about it. And it turns out that one of the ladies in the church had a cousin that worked in customs and was able to call her cousin and say, I want to give you a heads up about this. What's the best situation we can do to prepare that these medicines can get through? And going through customs, one of the ladies asked for a bottle of vitamins, and we were thinking, we'll give you as many vitamins as you want if you let us go through. But we gave her 5 bottles of vitamins, and we made it through just fine, which was kind of a miracle in itself. So what can we expect? So Kenya has just 1 doctor and only 12 nurses or midwives for every 10,000 people. In contrast, the US has 24 doctors per 10,000 people. And how many nurses would that equate to? So the government care is free, but the medications are out of pocket. So sometimes the Kenyans will find the diagnosis, but they can't afford the medications, and therefore they can't get better. At the pharmacies, you can actually go and buy anything you want, except for probably controlled substances. But you can buy antibiotics or whatever you need, but without a doctor's prescription. But still, the medical cost is more than what most Kenyans can afford. Few Kenyans have financial access to medical insurance, although it is offered through the government and through private entities. Even if a Kenyan recovers from the illness, sometimes they have it for so long before they get well that there are long-term disabilities and they can't work again for the rest of their life. We found out on arriving in Kenya that the government nurses were on a nationwide strike, so all of the government-run clinics, all the government-run hospitals, there wasn't nursing staff. So you had people that had been very sick for a long time without even the most basic health care. So think about the worst infection you've ever had, whether it was respiratory, or think about when you had maybe a dental infection and you really needed those antibiotics and you have no access to care for over a month. It's pretty hard. They did have some resources for very, very emergent situations. When I was there, there was someone that was taking care of a woman laboring. But other than that, they weren't opening the clinic for any other reason. Common diseases in Kenya. So we were trying to figure out how we were preparing for this. So of course, malaria is on top of the list. Malaria is very prevalent in Kenya. And there's some statistics about how every child, every 30 seconds, is killed due to the effects of malaria. And while we were there, we met a number of people that we worked with that had lost a child to malaria. It's the leading cause of death in children in Kenya. There's also the HIV and AIDS epidemic that I was talking about, which affects about 7% of the whole population. Currently, the medication is free from the government if you go to the sites, the government sites. But I imagine during the time of the strike, that's going to be more difficult. And also, there's transportation issues. They might say the medication is free, but you have to go to this facility that's 5 miles away. And if they don't have the transportation to get there, they won't have compliance. There's also a social stigma with HIV. So if you had HIV, people could be embarrassed about it, or maybe your family was embarrassed about it and they wouldn't let you get treatment. So the fathers, and it's a very patriarchal system, the fathers would determine whether you can get treatment, or the husband would determine whether it was okay if you got treatment. We also have the contaminated food and waterborne diseases that we were talking about, and really the highest mortality comes with that because of the severe dehydration. If you can't keep in your fluids, at some point it starts to cause too much stress to your organs. And the second leading cause of death in those worldwide or developing countries of children less than 5 years old really is those contaminated food and waterborne diseases. There's also rampant tuberculosis, and lung infections account for 12% of all the deaths. Cholera epidemic outbreaks are really common there. So it's a gastrointestinal disease. It's found in contaminated water. It was a really great compliment to us that when we went and visited the schools, the first time I went in 2015, that we were teaching those kids about washing their hand and counting while they were doing it to make sure they did it for the right time. And the principal of that school, I was writing to him after we got back to the United States. He said there was a cholera outbreak in that area specifically, and he said not one of his students was contaminated with cholera. And he said part of it really was the teaching of the children and asking them to wash their hands and to teach their family members to wash their hands. Also, one thing we don't see too commonly in the United States is a parasitic form of elephantitis. So you get the big bulging legs. In men, it can cause a collection of fluid in the scrotum, which of course is extremely uncomfortable. There's such a disfigurement, and people are disabled with this that they can't work. So it has other repercussions. Actually, Kenya does offer an injection of treatment, and their goal is to get this eliminated by 2020, that people can get their treatment fast enough that people don't have the sequela of this illness. Malnutrition accounts for 4% of all deaths, mostly in children. Other common conditions that we were expecting to see, and we did see, hay fever, fungal skin infections, bacterial skin infections, a lot of scabies was pretty popular, eczema, constipation, acid reflux or heartburn issues, menstrual issues, bleeding too much, headaches, neck and back pain. You can imagine that these women are carrying these heavy packs on their head for miles, 3.6 miles, carrying that on your head. At some point, that's going to take a toll and give you headache, neck pain, and back pain, and those were really common when we were there. Other things, tendinitis, sprains, strains. We saw bone fractures that had never been treated, open trauma to the skin and soft tissue. A lot of the kids are running around without shoes or socks on, so of course they can get injuries pretty easily. And then diseases of the developed countries are starting to be more prevalent there, so diabetes, hypertension, obesity-related issues. Okay, so what should we bring? So we brought antibiotics, antiparasitics, including, we were bringing mostly for GI parasitic disease. It was actually cheaper for us to buy the malaria medicine in Kenya from the pharmacy. antifungals, malaria medication, topical skin medications, steroids, stomach acid medicines, hypertension, diabetes medicines, of course, simple pain relievers. It's pretty easy to get to the Tylenol equivalent over there, paracetamol. But they, of course, if they find out you're giving away medications, they want to know what American medicines you have, and they think that's better. Simple pain relievers, simple surgical procedures and materials, splinting and casting materials. And we actually had a large donation from a really great place called Brothers Brother. If you're ever going on a mission trip and you need medical supplies, look up Brothers Brothers. They're a nonprofit organization that will let you order what supplies you want, and they will tell you what they have in donation, and they will give you what you need if they have it available. And they're just fabulous with getting the medicines to you, and the only thing they ask in return is that you send them pictures of documentation that you actually use those materials and those medications to your designated site. All right, so Kenya team 2017, it was a small team of medical professionals and then other people, including teenagers and adults with different kind of backgrounds and professions and careers. But our main team of medical professionals, coming from the left to the right, is Jen Arrett, and she's a pharmacist, Tanner Olinger, and he is a med student actually from the University of Montana. Woo. He did a rotation with me in Stevensville, and I roped him into coming on this mission trip. I was like, Tanner, I knew he loved to travel the world, so I said, Tanner, you should come with us. And at first he kind of was like, oh, I'll think about it, and then he was like, no, I want to come. So Amy Berglund, she's a chiropractor, great chiropractor in Stevensville, Montana. Of course, me, and then my friend Jean Higgins Pareto, she's a physician assistant in Stevensville at the Lifespan Clinic. And then who did we see? In total, we evaluated, we were only seeing people probably 9 days are the days that we were, I think, practicing and seeing and treating people. It might have even been just under that. But we saw 1,500 people while we were there. It was an amazing amount. I think we underestimated how many people we would see. We went to 5 schools, and like I said, those rural schools on average have about 300 or more kids. So we would be doing physical exams, and it would just seem like this never-ending stream of children. We would go from one classroom to the next, and then I was like, are some of these kids repeating? There were 4 village centers. There was 1 village clinic that we took over one day, and then 1 HIV/AIDS support group, and 1 prison that we went to. So these are some of the fun pictures of what we did. This is why you came here. This is the good stuff. So this is a picture of one of the schools that we went to. Most of the schools that we visited actually just had dirt floors. This one's a nice school. It actually has a real floor. They have the chalkboards. They have very limited pencil and paper. It's only limitedly given out. This is Jean Higgins. She's taking blood pressure. This is where I'm looking in someone's ear, but the high schoolers, of course, are really inquisitive, and so we got done evaluating the high schoolers, and they wanted to learn about the medical equipment and about practicing medicine, and so they were practicing on each other. They were doing blood pressures on each other. They were checking ears. They were listening to each other's hearts. And then this is Tanner meeting one of the high schoolers that we were evaluating. This is another little clip of the amazing singing. There's singing everywhere, which I think my family likes because we sing a lot too, but their singing is a little different, more coordinated. Oh. This was their greeting for us sometimes when we would come to see the high schoolers. They would coordinate their choir to sing for us. And they're catchy. They're always really catchy. So later in the day, we would look at each other and go, Sema. We don't even know what we're saying. Sema. Oh. All right. More pictures. So this is Jen. She's checking blood sugars. We brought quite a few supplies for checking blood sugars, but if you ask the Kenyans, if you if you have symptoms of diabetes, we'll check your blood sugar. Everybody will find a symptom to say because they're curious about it. And so everyone wanted their blood sugar, and we were running out of our supply, so then we had to be pretty selective. But at the first high school, almost every student got their blood sugar checked. And then this is Amy. This is kind of trying to figure out in that first high school where she can treat people, so it ended up being a desk. And so she's applying a wrap that's going to be a make-do sling there. And this is Amy with the girls showing off the vitamins. All the teenagers got a bottle of vitamins. Okay. And then this is talking about those makeshift stations. So here we are at another high school, and so they found kind of a coffee table for Amy to treat people on. Of course, it's hard when you have some of these taller Kenyans. And then this is Jen. She would have to find a place to set out all of her pharmacy equipment that we were all going and making messy as soon as we got started. And of course, there was Jean checking blood pressures again. And in this picture, Jen is actually checking pulse and the pulse and the oxygen levels of the children, which of course they were fascinated that they could find out how much their pulse was just by putting that in on their finger. And Amy and Tanner, after we would get done with the exams on the kids, we'd give them a high five or tell them good job. And there was teaching. We would kind of reiterate some of those things that I was telling you in the 2015 trip about telling them about washing the hands. With the little kids, we'd actually make a little song out of it. They know some of the American songs, like if you're happy and you know it, clap your hands. And so we would say, if you're happy and you know it, wash your hands. If you're happy, and we'd go through the steps of use the latrine to kind of make it more in their memories and fresh on their mind. Okay, how do I stay healthy? I wash my hands, I'm boiling the water, I'm using the latrines, I'm brushing my teeth. And we showed them how to use brushes made out of tree branches. We talked about alternative toothpaste. And so at every place we went to, this is the school actually over here. This picture probably shows 1/4 of this whole arena of the kids at this school that had no bathrooms whatsoever. So they're just walking out to here, walking out to there, finding a bush, and now they actually have formal bathrooms. Some more pictures of us treating and evaluating. Tanner in the middle is treating an open skin wound. There were lots of open skin wounds because, of course, they're traveling long distance and their work is pretty physically laborious. Some more pictures there. Go back one more here, honey. This one, I like this one because, like, again, even the smaller children, they were like, can I listen to my own heart? I want to know what it sounds like. And it was kind of so busy and noisy, I'm not sure exactly how much they heard, but they had so much fun doing it. And I think it kind of encouraged them to think about what they wanted to do with their lives when they were older and opportunities they might have that they had not recognized. And this is Jen, of course, like working on the pharmaceutical supplies in the area we were checking out the children. You can see the little heads peeking through, being curious about what's going on. Also being a little hesitant. I think they were worried when we first got there that we might be giving shots, but we weren't. And thank goodness for pharmacists. So Jen had one of the hardest jobs. I really hadn't set out to find a pharmacist to go with us necessarily. I was just inviting all sorts of people. And Jen is a really good friend of Amy, and I had asked Amy Berglund if she wanted to go on our trip as a chiropractor. But every night, Jen would reorganize. This is the lobby of where we were staying. Every single night, she would reorganize, and we would help to some extent, but she was mostly in charge of it, reorganizing every single suitcase. And there was a time where we divided up, and so she actually had to make 2 sets of suitcases with everything in it. And then she would make everything in these like tiny, small dispensary bags like this. And we ran out of the tiny bags, so we were actually using pieces of paper and folding them into triangles and putting it on and then labeling it. It was crazy. I'm trying to be a student. I think they might accept me, but they might have to see my scores first. So while we were doing the medical exams, the rest of the team was entertaining the kids. And at one of the schools, they were actually planting some of those trees that we had talked about where it was preventing some of the soil erosion. And so the kids got to help with planting trees. and playing Duck Duck Goose. If you want to see something really entertaining, is seeing 200 children trying to play Duck Duck Goose at the same time. And guess what? Our team didn't do as well as the Kenyan children, of course, by running. They always were caught. So this is a cool story about this little boy. His name is Stephen, and you can see kind of how precious his face is. But Stephen had sliced half of his toe on a rock, and it was filthy, and it was full of dirt, and it was starting to get inflamed and infected. And so this is a big difference between practicing in, medicine in Kenya versus practicing medicine here. Is I wanted to ask the parents if it was okay if we treated them, and the principals and teachers said, if you can treat him, you should. And so I actually had to resect part of the infection and numb it up. But he was a good sport about it, and you can see Lindsay's trying to distract him there with some entertainment, so he's not feeling it. And these are some pictures of the Adieto Village Clinic. So we took over the clinic one day. We got there first thing in the morning, probably around 8:30, and there were already 80 people waiting. It was pretty incredible. And then I asked the question, how do you see 400 people in a day, and you have to order a miracle? And fortunately, the nursing school that is affiliated or has a relationship with Spring of Hope offered some of their nursing students to come and help. So this is a table, and these two individuals are nursing students. These two individuals are nursing students, and the nursing students do more there than they do in America. They actually do an assessment, and they actually start to make recommendations, and then we would sign off on it. And then these women are amazing. They're part of a CHE group, which is a community health organization in which women that have become widowed due to their husbands dying of HIV, they actually support each other with table banking so that they can be independent. It used to be if you lost your husband, you had to wait for another male member of your husband's family to take you in. And sometimes they would just abuse you, or sometimes they would say they were going to take care of you, but then they wouldn't come through with it. And so you were just at the mercy of what people could give you. But these women are transforming what happens with women when they're widowed and supporting their families. And so they're a large organization, and these two women are leaders and pretty amazing at what they do. These are pictures of the clinic and us helping different people at the clinic. It was very hot because there's no ventilation in there. And this is a woman, her name is Teresa, and she came to us. She was sitting on the ground and her head was covered, and she had an abscess on the whole entire side of her face. And she was in a lot of discomfort, and one of my friends came up and said, "Can you see her before some of the other people?" And I said, "Of course." And so we had to debride all these infections. And based on the appearance of her face, I was pretty sure she had cancer. There was some deformity. And so I gave her, after we helped her, she was very, very grateful. But I gave her a lot of Tylenol because I knew she would be in a lot of pain, and I actually didn't expect her to live very long. And one of the nurses said, "I've never seen anyone give someone that much Tylenol at one time." And I said, "I don't know if she has a long time to live, and I'd rather her be in comfort." And she actually passed away 3 months after we left. The cancer had spread to her throat, and she couldn't eat any longer. But for that day, she was very grateful because here she had been suffering with this infection for over a month without being able to get any help. So these are more pictures, feeding the children. This is Jerry. He was feeding the children our watermelon stores because they were there all day. We saw people from 8:30 in the morning till 7 o'clock at night, and the people were there all day. They didn't want to lose their spot, so they wouldn't go home to eat, and they were very hungry. And of course, he's getting a hug for it. And the pharmacy before and after, all well organized, complete chaos at the end. This is the village centers, us going and serving at the village centers, which was just like a magnet. As soon as you arrived, there were just people all around wanting to be seen. And this time we actually tried to divide up, which wasn't actually probably the right thing to do because it was too hard to organize our supplies and our system. So that was a day that we learned that we need to stick together. There's the HIV support group that I was telling you about where they grow the trees. This is actually their vegetable garden, which is growing better than their little tree and planter garden. But we saw all of them and treated all of them, and if they had families, they would bring families. And this is us visiting the prisons. In the prisons in Kenya, you get nothing. Like, you don't get toilet paper, you don't get soap. Unless you have someone from the outside that donates it to you, you get nothing in Kenya. And so we donated toilet paper and soap and basic supplies, and then we actually saw some of them for minor medical conditions, which they were really grateful for. There's a picture. This is from our first trip. We gave them Bibles, but the thing is, sometimes the officers confiscate what you give them, so we actually still aren't sure whether they got to keep those Bibles or not. And then that's toilet paper, donating them. And at this time, in 2017, this is Jean doing minor surgery on someone. All right, and then I got to see Eric again. This time I knew to be prepared and get him a cool soccer ball that I ordered off of Amazon. And this is a picture of all the sponsored children that we visited that day. We had them all come in and they all get prizes. If you give your sponsored child a letter, if you give them pictures, if you give them color crayons or markers, they actually give you a picture of your child holding that so you know that they got it. This is us, how do you travel like sardines without air conditionings? It's pretty squishy in there, thank goodness there's good windows, but if you're stuck inside for a little while, it can be kind of hard. Next. And this is the reward. So the children's faces, the people's faces in Kenya, these smiles like this are contagious in Kenya. As soon as someone smiles like that at you, you just have no choice but just to feel this warmth in your heart. And so this is our friend Becca holding a newborn baby at a hospital that we visited. This is me playing Ring Around the Rosies with the kids. This is them playing jump rope. These are kids that we saw when we went to go to a natural springs. And they just follow you around. What did we learn? That Kenyan villagers are happy despite the lack of their basic physical needs. And it made me think about the Grinch line about maybe Christmas, but I changed it to happiness, he thought. Doesn't come from a store. Maybe Christmas/happiness perhaps means a little bit more. Because they don't have, iPhones and they don't have cable television, but what they do have, they absolutely love, and they're so faithful and so grateful. Kenyans inspire us with their faith and their generosity even towards us. And going on a mission, you gain more than you give. Life has new perspective and meaning for sure. And practical tips, it's always good to review what you did and what you might want to do, because I would like to do this again in 2019 if anybody's interested. But bring medication for seizure disorder. We had quite a few people asking us for seizure medicine that we weren't prepared for. And glasses, they just do not have access to glasses. And so we had one person in our troop, and I think she worked for an insurance company, so she had no background in being an ophthalmologist or optometrist, and she would just have little samples for people to read. Can you see this letter? Can you see this letter? And they would try on different glasses to figure out what they needed. And there were 2 glasses donations that we got. One was only a right side and one was only a left side. And we were like, I don't know if we're going to use these or not, but we brought them along. And wouldn't you know, people would specifically come up and say, well, my left is good, but I have a hard time on my right. And they wore those glasses and they were just happy as a clam. Bring more friends and practitioners. So again, if any of you are interested or you know someone that's interested. And then how can we be a part of improved health in the world? We can support the organizations that have programs for improved and clean water availability. We can sponsor childhood education programs. We can be a part of spiritual encouragement and support. And also stimulating economic development and educational opportunities associated with this. And through Spring of Hope, you actually can sponsor someone through high school, which of course is a little bigger donation. You can support people going through university. And then also, don't forget, you can go on a mission trip or you can donate to someone going on a mission trip. Spring of Hope International, David knows I'm here tonight, and he said, I specifically invite each and every one of you, if you want to go on a mission trip or want to be a part of this organization in any way, to contact him. You can sponsor a child, and like I said, there's pamphlets back there if you're curious about that, $35 a month. And you can donate to a particular need. You can donate towards catchment, a well, the farming seeds or the livestock. And then I wrote, of course, the website again here. And then Gifts from Afar, I like to include a sciencey aspect to it. My degree here was cellular and molecular biology. So I like to look at the epigenetics, which is our expression of our DNA. Our DNA is not concrete for what has to happen. We can have an Alzheimer's gene, but we never develop Alzheimer's because it's a matter of whether we express that gene or not. Just like we have cortisol ability, that our body can make cortisol, and sometimes there's factors that make our DNA produce more cortisol, and other times where it produces hormones that actually relax us. So people performing altruistic acts have increased immune factors, increased longevity, reduced rates at early death by 60%. Men who are part of contributing to something that was volunteer, they had reduced stress, a sense of joy and peace and well-being. So I think those things are all good to consider. If you're going on a mission trip, you're getting all of that goodness. And even if you're being a part of donating to someone going on a mission trip or an organization that's doing these things, you actually receive a physical benefit to it. And then face connections to healing, that there was a professor out of University of Miami, and she studied HIV patients in the United States, and they were on the exact same medications, exact same protocols, but the highest predictor for whether or not they were able to overcome the HIV or at least stabilize or improve their condition was whether they believed in a benevolent God or not. So if they believed in a God that was all judging and fire and brimstone, that you deserve this for being such a bad person, that was the biggest predictor for them actually starting to fail their treatment and decline, versus people that were like, okay, I know there's a God out there, and it didn't have to be a particular perspective of God, but they actually had the best as far as reducing the number of virus in their body and the virus counts, and the best with improving their immune system, which had previously been dwindling. So don't underestimate faith. And then oxytocin, it's the world's wonder drug that's natural, and we get it through any kind of physical contact, whether it's physical, whether it's emotionally relayed. So even just a smile, even holding the door open for someone, you actually are getting an oxytocin benefit, anti-inflammatory, pain reliever, boosting the immune system. So looking at these pictures actually of the Kenyans just actually does that for me. I can feel like I'm having that response like I would with oxytocin. And then I like this too, this Mother Teresa quote, if you want to change the world, go home and love your family. So it has to start at home. It has to start with what you're doing. Like people could be, phenomenal with, I'm going to go on a mission trip. But if you're not connecting with the people that are in your life right now, you're not getting the full physical and emotional, spiritual benefits of what's right in front of you. And I think that's really important and super easy to forget in our busy lives. And how this personally impacted me is that I've studied and learned more about wellness and prevention. I left my traditional job to spend time actually being a wellness coach because I wanted to be that motivating factor for people, and I wanted to have more skills to give people. And I currently have a practice in Hamilton that integrates that traditional family medicine with the strong emphasis of promoting wellness. I have a deeper understanding about the physical, psychological, and spiritual well-being. And then it gives me the opportunity to practice those things myself. So when I'm sitting with someone and I'm telling them, well, how much time do you take taking care of yourself? And maybe it's a busy mom and she's like, well, hardly never. And I'm like, well, let's think about that. Like if you had a car and you never fueled it, how far would it go? And so it gives me the opportunity to offer those thoughts to people if they're not integrating that, or if they already are, to give them a bigger toolbox of other ideas. So this is the end. This is a cool little picture of my friend Becca. She's the one that took the awesome safari pictures that you saw when you're coming in, and I'll do them again. And she was laying on the ground with the kids. Well, I was, of course, slaving away, evaluating kids. I was a little bit jealous sometimes, but I loved my interaction and what I got to do. And this is her holding the hand of a Kenyan child, which I think is just absolutely precious. So we'll run the safari slide again, and if anybody has any questions, or if you're in a time crunch and you need to go, you can find yourself.
Let's give Angela a round of applause. We have some time for questions.
You specifically mentioned seizure disorders. Is this, how did that come up on your radar?
Oh, well, when we were at the Village Clinic, there were a number of people that waited a very long time to come in and say, do you have seizure medication? And I have a seizure disorder. So some of them, I believe, probably have it just like Americans. There's a certain incidence of people that just have a seizure disorder, and sometimes we never know the reason. But there are sometimes certain kinds of viruses, bacterial infections, and especially parasitic infections that can cause seizure disorders in patients. Even after they've overcome the infection itself, they can have a permanent seizure disorder. So it's kind of hard in that context to know, like, the population of people that approached us, where they were with how that happened or how that evolved. But
This is an unusually prevalent issue in the community.
yeah, I don't think it actually probably is, but I think that those people were seeking the medication and the treatment, especially with the absence of the Village Clinic being available to them, that they were asking what kind of opportunities we had to help them.
Let me follow up on that. What kind of traditional medicine was practiced there, and were you able to complement that?
The way that they practice medicine is similar in America in a lot of ways. What they have is actually, it was funny, the tests that they can do on site is different than what we do on site. You know, for America, like influenza season, it's really nice to have influenza on board. We have strep throat. You can have checks of it any time in America. But for them, with the hot spots being malaria, tuberculosis, HIV, they have actually instant results on all of those in their clinics. So if you come in and you think you have malaria, they can do a test right then and there and decide if it's positive or negative. So that's one difference. But as far as the structure of how they practice, I would say it's a little similar to United States, where you have a nurse or a doctor. They also kind of have an equivalent of mid-levels to what we have in United States. So mid-level would be like a nurse practitioner or a physician assistant. They kind of have an interim level where it's not quite a doctor, but it's not a nurse. I think they call them medical officers. And so some of the medical officers will be the ones that are at those Village clinics, and so they'll assess. And then sometimes they can give you the medication right there. They do have some medications available, and then other times they refer you to the pharmacy to go get your own medications. I think if you're Kenyan going to the Village clinic, I think you might have to still pay for the medicine if the Village clinic is giving it to you. So the structure of it is a little bit similar to Western medicine. And you see the provider, then they give you a diagnosis, you do the test, and then they give you the results and give you the treatment recommendation.
How about traditional healers? Are there traditional healers in that part of Kenya?
There are some traditional healers. They're kind of our equivalent of maybe what we would call a witch doctor, the ones that are very traditional. I don't know if they're traditional in the sense that this was what Kenya connected to, hundreds of years ago, but they definitely stick out. They wear very unusual clothing, and in fact, one of the people on the mission trip saw one and tried to take a picture, and they were told you should never take a picture of them. Like it's for one, like a bad omen, and for two, like they can get really mad. But they would wear like these big head garbs that were really unusual. They would wear a robe that was really unusual. And I don't really know what they did. I don't know if they had tinctures or what they would if it was hands-on. But they do have people like that. And then they have their own home remedies for things, mud treatments or salt for cleaning, salt water for cleaning. So they had their own home remedies. But as far as what the witch doctors did, I'm not actually sure. Yes?
Does Spring of Hope do any kind of impact or outcome evaluation? And did you have a chance to do that with your mission trip?
We would like to. It's been talked about, but we don't really have a objective way of evaluating that. We have a subjective way of evaluating that because Spring of Hope actually has 4 full-time social workers who work there, and so they're there 365 days every single year. And so they interact with the children that are the sponsored children. They interact with those CHE women's groups I was telling you about. They interact with the HIV and some of the business groups, like they're supporting the farming school. So when we go there, we do hear about this, certain impacts based on stories, based on what was relayed in that, and more of that story fashion versus numbers. But at some point, David would like to record like who we see, when we saw them, what the outcome was. But it was pretty hard to meet the demands of what we had, because everybody had to have their own interpreter. And one thing is that Kenya, their national language is Swahili. And I actually tried to practice some Swahili before I went, but the village areas have their own dialects that are so different that sometimes I would try to say a Swahili word and they wouldn't know. School children might know because they're actually taught English and they're taught Swahili depending on their education level, but they have their own dialect. So even if someone was to come with us from Nairobi, they wouldn't be able to communicate with the people that we were interacting. So by the time you get enough interpreters for the doctors, for the people that are helping them in other ways, there really wasn't anybody else probably to do that legwork. But it's an excellent thought, and it really would help the cause to be able to prove more of those statistics.
The point you made about the incidence of cholera among kids receiving the hand-washing education is interesting.
Yeah, right. So that would be kind of like a little subjective, there was no formal evaluation done in the area to see who had contracted it and what relation they had to the school. But it was, the principal was really emphatic that he thought that played a really great role in that epidemic that happened right after we left.
Any other questions? Well, I want to thank you once again for a very informative and detailed description of the work that you did in Kenya. It's quite impressive, so thanks a lot, Angela. It's really interesting because we, in this lecture series, just kind of, without any great planning, it just happened that a lot of the talks have had to do with East Africa. So we've already had one talk about Kenya. We've had a talk about Uganda. We've got Kenya talk again tonight. We've got Tanzania coming up at the very last lecture. And next week spring break, but 2 weeks from now, we're going to have a talk about Ethiopia. So we have Nora O'Brien coming all the way from Ireland to give a talk on nutritional status of lactating women and their children in 2 agroecological zones of rural Ethiopia. So I think you'd be particularly interested in this, Angela, because she does a lot of work with nutrition. And her husband, Tom O'Connor, is going to give a seminar that afternoon on blended fortified foods in my class. So there's those 2 things that you're both invited to, all of you are invited to attend. I just want to make one personal comment about your decision at the age of 6 to become a doctor. It reminded me of the time that I was teaching in Nigeria. And my daughter went to school at a Nigerian school while I was there. And at the end of those 2 years, she asked me, she said, when we came back to Montana, she said, I'd really like to go back to Africa sometime. And I said to her, I'll never forget this, I said, if you really want to go back to Africa, become a doctor, because they'll always welcome you back if you're a doctor. And she did. She became a doctor, and she actually just recently resigned as co-director of the family residency program here to try to get more people working and more doctors working in rural parts of the state. And she's going back to Africa right now with her family. So I really found that quite inspiring and interesting that those kinds of things can happen at a very early age. So Angela's got time for personal questions. If you want to come down and talk to her one-on-one, that'd be great. But thank you all for coming.